Walmart, and I was just reaching for something on the off the shelf. And once I made that reaching motion, my lower back on both sides, it felt like I was getting stabbed in the back. It just inflamed. So I paused, I rubbed it out a little bit, and just going from there, it didn't feel like I could make it out of the store. I got out of the store, sat in the car for a few minutes, drove home, walked in the house, and as the morning went on, it got worse to the point at the end of the day, I couldn't even walk. Laying down, I'd lay down. It seemed like the pain would subside if I'd go to get up, just trying to use my muscles just to sit up. It was very painful. So I'm not sure what caused it.
How did you get out of the pain at that moment? When you were in pain, right?
I was in pain.
How did you get out of that pain to get up and walk around?
I used some anger and aggression going, I have to get back home. I set the mind to say, okay, I have to get home.
When you were at home and you were in a lot of pain at that point, at what point did you get out of pain? How did that happen?
It didn't happen. The pain would constantly be there. It just didn't.
It's still there.
It's still there. Yeah.
Pain. Okay. Okay. All right. So I want to put you in this chair right here so I can see.
Okay.
Right here. I want you to sit here facing that direction. Maybe take your shirt off so I can come from behind and see what's going on.
I noticed yesterday and the day before when I just walked into the bathroom and looking at my posture in the mirror, it didn't look like my torso was straight. It looked like I was leaning to one side because of the...
Yeah. You have... I'll tell you what causes that. So take that shirt off too, if you don't mind.
Sure.
So we can get behind you.
It even hurts to lift my arms over my head. Putting on my socks, that's 5-minute ordeal.
Yeah, I've got a gown that I can actually put you in as well. So
I laid on my bed, pulled my knees up to my chest, and right when I did that, my back in the center cracked. I thought, okay, that felt good. That relieved some of the stiffness. And then I seemed okay, and then I ended up with this.
Okay. So how long have you had back pain altogether from day one to now?
Off and on. It really started in 2018 was when I noticed my first really bad back experience.
2018.
Yeah.
All right.
And then it would go away, subside. I went to the doctor, got some topical ointment, and just paid attention to my motions, how I would move, and
went to a regular doctor?
Yeah.
We give you ointment?
Yeah.
Ointment?
A topical cream.
Topical cream?
And some Vicodin, pain relief, but I didn't take that. It didn't work for me. I had a hernia surgery in 2014.
Oh, you had a hernia surgery?
Yeah.
Where?
So in the front, I had a bilateral hernia. Ever since then, my core strength hasn't been that great.
Okay. Let me ask you some questions.
Sure.
When I look at you from behind, you have structure that's not quite normal. You go a little bit to the right side. Are you sitting normal right now?
I'm trying to actually sit upright and square. So I feel like I'm sitting upright and square.
You're looking pretty good on the base, but you come up and there's an angle going to the right side. Okay, so I'm going to look at everything, okay?
Uh-huh.
All right. So you had a problem for a long time, and did you do anything interesting that this happened, or how did that happen?
No, nothing. My backaches have always stemmed from not doing anything interesting. In 2014, I noticed I had kind of a pulled muscle in my neck, so I went to a local chiropractor in my neighborhood, and he massaged it out, put like one of those TENS unit type deals on my neck with the pads and the electrotherapy. That seemed to help. I was never into, you know, cracking my back or, you know, having my neck snapped or anything like that. At that time, he pressed on the center of my back. When he did that, my back cracked. But
well, you have a problem right here. I'm taking my, trying to figure out what's going on with you from day one. What's happening to you? So, there's a pain here. There's another one right there. So, you have a pelvis that's really interesting. It's down here. So, I want to make sure the pelvis is working really good, taking up all the loads that it should be taking.
now with this lower back inflammation I've had, this morning, I didn't go to work in the office on Monday, Tuesday, and Wednesday. I worked from home. This morning, getting up, trying to get through my normal morning routine, I noticed I have a little bit of an ache and a pain going into the hip on my right side, going around to the front, which I haven't noticed that before with any back aches.
Okay. All right, so this is what I'm finding on you. I'm not finding anything yet. I've got to figure everything out. But there's going to be pain in this region if I go like that. Is that pain right there?
No, not pain, just uncomfortable.
How about here?
No.
Here?
No.
Here?
No.
How about here?
No.
How about here?
No.
How about there?
No.
There? There? My machine is telling me that there's some intrinsic pain in this region. So that
Okay,
bone,
right there.
right there, right there. That's exactly where I'm thinking. Okay. Now, the next step is to take a picture. I need four X-rays. One like this, one like this, one sideways, and one sideways. All right. So this here's your neck. The neck has got some problems because the neck is getting together right here. They're touching. And what happens here, you have a brain that will come down this way. The spinal fluid will come down this way from here, and it goes down to your back. And the spinal fluid gets impeded by the bones growing right here to here. So that's beginning to close off. So this is your right direction, and this is not good to have your neck on such a big angle. So let's see, where does that, and these bones are almost touching from behind. You have a bone sitting on top of a bone like that. So regular chiropractic can't really do that for you. I'm going to see if I can move those bones. You have two legs that come up to the pelvic area, coming straight up. These two lines create a problem. Trying to align the whole structure. So got to move that bone forward and look on top where there's a pressure I can't see here. So this is going to tell me 2 points that I made in your spine are coming up. One is up in here, and then a couple of down below that I'm going to do to get the spine in the proper alignment. Okay?
So you have to crack my neck?
No.
Okay.
No, you don't have to get anything cracked.
Okay. Okay.
I can just go like that. Listen, it's very easy.
I'm a little stressed, so.
No, don't worry about chiropractic tension is very, very light. That's not a big deal at all.
Okay.
I push a bone. I push a bone, and the biggest bone that I have to push is your fifth lumbar. It's gone really, really back.
Okay.
if I don't push the bone, you're gonna have surgery. Pushing the bone is just, okay. But not cutting you up and then getting all sorts of problems later on. If they can't fix it, then you have a big problem, forget it. So what I need to really do is get in here and put my hand on this fifth lumbar and push it straight forward.
Okay.
All right? I'm gonna start off by checking your spine on the machine, and then we'll take it from there.
Okay.
All the way down, and then your body is gonna go exactly, your body goes right there, and let the spine go down, all the way down, all the way down, all the way down, all the way down. And let go of the pressure in here, see? Let go all the pressure there, right? And you know, when I said on your neck is a problem there, it comes like this. So, first of all, I just want to see if I can get these bones to move a little tiny bit. Good job, good job. Drop here, more relaxed, drop more. Good job, good job. You know what? That's really great, you know? And so these are the spots that create a problem in your spine, right?
I still feel like tense. Am I still too tense?
Yeah, just relax. You know what? This is hard for you because it's chiropractic, but you know, it's just moving bones. It's very easy, very light, very light. Go all the way down. I'm gonna push this down a little tiny bit. Drop more. Deeper, all the way down. Drop.
Oh,
Did that move at all?
I felt something.
You felt move, right? That's what I
Yeah.
want, just a little tiny thing that coming up.
Ooh.
Coming up slowly. Push up with your hands and stand up. You did really good. You did really good, man. Hey, man, you're a trooper.
Well, you know, I'm gonna have pain one way or another, right?
No, you're gonna be fantastic. I'm telling you.
The pain on this lower side
You
that
look
I
at
was
that
feeling,
next. Yeah,
I don't feel that.
got it. Stand over here, please. Stand like that.
Like the inflammation seems to have
Yes, I moved the bone.
subsided.
I moved the bone. Just a second, please.
Okay.
Yeah.
How much are the bones moving? How much of a movement?
Very small. Very small, okay?
Okay.
Now, I want you to walk up to that wall again slowly. Come back towards me. Is that how you normally walk?
Well, no.
Okay, good.
But when I have this pain,
Yeah.
it feels like my body's just in
Okay,
what it's trying to do to be comfortable.
okay. Walk again that way to your comfortability, wherever you can. Just walk as comfortably as you can. Okay. All right, I'm going to check your pelvis area now, okay?
Okay.
So I want you to stand right here.
Okay.
So I'll be behind. Lift up your left leg slowly up in the air, please. With just a knee coming up like that, okay? Lift the knee up. Knee comes up, come up, all the way up. More and more, faster. And then down. Bring it up a little faster now, all the way up. Bring the left knee up. Good, down all the way. Up on the left. And then down. Lift this leg up, the right. And down. Lift the right leg up again. Up again, please. Up on the left. Up on the left. Yeah, this is bad. This cilium is bad. Lift this up again, the right side. Okay. All right. We have to do something to this ilium. But what do we need to do? So let's investigate further, okay?
Okay.
We're gonna go on this table here where you were sitting. Okay, now. Now, I want you to keep your feet together.
Together.
Yeah, and then you will open your legs, open, and then close. Open wide, and then close. I'll be behind you looking at the pelvic area.
Okay.
Okay? I'm gonna do everything I can to make everything work for you, okay? Open your legs together now.
Open up.
And close them. Open. And close. Open. And close. Open. And close. Now, leave the right leg closed, open the left leg only.
Okay.
Close. Open the left leg now.
Open left leg.
Okay. Yeah, close it. Now open the right leg. Open again. Close. Open the left leg again. Left leg again. And down. Okay. Put your head right here.
Okay.
I'm going to try to move your bone. It's in your sacrum area. It's not even in your back. It's not a big deal.
Okay.
You know, it's a small movement that I'm going to do.
Okay.
Very, very easy. Oh. You have pain in the back right now?
I did have for a quick second. Right now I don't.
You have a lot of inflammation right now in your back, right?
Yeah, a lot of it.
Yeah. So this is involved side down, okay?
Wait, what?
You're involved side down, not a big deal. I'm gonna move this bone, just relax everything, drop everything, put your hand forward, forward, drop. There we go. Little by little, we're gonna get you in the right spot.
I didn't know what to expect though.
Nothing to expect, nothing to worry about. It's all taken care of. You're at home with the mama is gonna take
I know.
good care of you.
I know.
Come on up. Come on up slowly.
Ooh. Feels like I have
Now just walk around, let's see how you're doing. Just walk up to just walk outside and come back. Walk up to that wall.
Ooh.
Nice, good. Good look to the left. Excellent. Look to the right. Great neck, great neck. A lot of pressure on the neck because of the spine in here. It's making a big scoliosis in the back, right?
Okay, yeah. So with that adjustment that you did over there, will that help?
That really helps quite a bit.
Okay.
Your neck doesn't feel any pain right here? Small
I
leg?
feel you pressing on it, you know,
okay.
but I don't feel
Let's see
pain.
if I move this forward. Look at my hand just gently. Good job. That's it. Now, what I did was I moved the bone straight in, so there's no rotation in the spine. I just moved it straight forward. I didn't twist the neck.
Right.
Just went straight down. Remember how the neck has got a thing underneath? The bone underneath is covering that other bone that's sitting like that.
Right.
So it didn't twist that. It went straight through. Not a problem. How do you feel right now? Now I want you to take a big walk because that is a key problem in people with back pain. And just see how you feel. Good job for one day. I want to get a feedback from you. How do you feel right now?
The pain levels from what I felt the past since Sunday morning through yesterday, even this morning, the pain levels are completely reduced right now.
Thank you.
Completely reduced.
Thank you.
Night and day difference.
Thank you. Okay, well, I think
Thank you. I appreciate it.
you're welcome.
This is a big deal.
Yeah, thanks, man.
Yeah.
Now, we have proper x-rays, tell us exactly where to go. We have the right bone to be moved. I think you're gonna be in great shape. You have to do this periodically. You do what I'm telling you, you're gonna live.
So with this adjustment, it's going to
Yes, it's gonna help you.
help.
Everything's gonna be perfectly okay.